All right, Melissa, we're live. What's happening today?
Hey, everybody. Got some really good guests. Lisa looks really good now. Her camera's all set up properly.
Maybe. I don't know.
We don't know.
Yeah, we don't know.
All right, so I'm going to do the intro of like our people today because I'm prepared.
Yeah.
We're literally like
'Cause-
live right now, I think.
Okay.
Oh,
Okay.
fantastic.
We're like live right now. Like this is a live show happening IRL live. Go, Melissa.
So today we're going to have Christopher Wink. He's the co-founder and CEO of Technical.ly, an organization dedicated to technology and innovation. He has a background in journalism. He has played a crucial role in shaping the tech media landscape in Philly, and as a limited partner of Rare Breed Ventures. He also contributes to the venture capital space. He has been recognized as a rising power player by the Philadelphia Daily News for his impactful work. So that's pretty interesting. We also
we're pro Philly. We're pro Mid Atlantic.
We are pro Philly.
I did think you said Rare Beef Ventures, and I got excited for a second, but it's not in fact Rare Beef. So.
Rare Breed.
Never mind. I take that back. Nothing to see here.
My stutter. I'm sorry. We also have Sipra. I should have asked her how to say her last name. Laddha? Is that how? Yes. Good.
Yep. She says yes.
Sipra Laddha is a dedicated advocate for women's mental health and considered a leader in the health tech space. She has strong commitment to innovation. She actively engages in initiatives that aim to improve mental health services for women. She has been recognized for her contributions through her advocacy and leadership. So thank you, Sipra, for joining us.
And
today.
she is a medical doctor.
She is a medical doctor. She's got MD after her name. She is. And then we have a surprise guest. Am I allowed to say anything about our surprise guest today?
No, because we're gonna talk. We have some surprises for him. Okay. It's a dude, though. It's a dude. Okay. All right. Okay. On to the news show. Do we have any other announcements? I don't think we do. Okay. All right. Hey, Lisa.
Oh, hey. Okay. Unmute myself. Hey.
Oh, here we are. Okay, so like our big, so our image today made by Maxine Kowalczyk was primarily to talk about the fact that we may or may not be in the long, cold winter, but look how happy we are because we are prepared, not scared.
Speak for yourself. I mean, as our loyal followers, listeners, watchers know, Kat is the one who is ready and prepared for the long, cold winter, not me. But you know.
Yeah. Okay. So you guys, earlier this week we were like, oh shit, the world's ending. No one is going to make any money. We might have low interest rates, but we will have no money to buy houses and whatever. So obviously we talked to everybody we know who does not know anything about money, except for one person, that is Mr. Chris Klomp, who is the great American entrepreneur. And here's what he told us, which is both hopeful, not hopeful, and nothing all at the same time. This is what Chris says. I don't think he thinks we're in the long, cold winter. He says the proper answer is markets always overreact to news in the near term, and this feels more like the same. No one can predict the macro. It's a fool's errand. This is exactly what I was trying to do. So he's basically calling me a fool. It's no big deal. Some signs that the consumer confidence is deteriorating, but also plenty of signs that the economy is still pretty strong. We'll also say that the Fed has never before successfully engineered a soft landing, so history would suggest any soft landing this go around would be the exception, not the norm. But honestly, who knows? And he says, per Wiley Vandenacker, one of his co-founder friends, he says, buckle up and ride the ride. So basically, we have no idea. And look, we get included this amazing shirt.
I have one important, which is that, like, if you want to avoid doing it Argentina or like a whatever, like an Italian lira situation, I'm sorry. Like, let's ideally not have the president of these United States, whoever that may be in charge of the Fed. Just gonna put it out there.
Agree.
I don't want to do any Argentinas. I'm not into the Italian lira devaluation situation, whatever. Like, please, like, let's let some experts do this in a very measured way. We're not going to get it right. We're not going to engineer the perfect soft landing, but like, let's avoid like wild inflation situations. Thanks. That's all I have to say.
Yeah. God bless America. I do have to say, former President Donald Trump, I don't think you should be in charge of the Fed.
I can say that too. Like, I just think,
I don't think it's a good idea.
We all have to know our limits. That's a limit.
Agree. But anyway, here's a chart of the markets that I screenshotted from my E-Trade account this morning. This is kind of what went down the past 7 days. Like, kind of, I don't know. We'll see. Flash in the pan or long cold winter. I don't know. I do like the miserable way this landscape looks, and the fact that I would be more prepared than anyone else. So we'll see what happens. But Lisa, she'll be comfortably not dressed like I will. So anyway. Big news this week that I didn't really think was super big news, because Mr. Mark Nee, a friend of the show, also important guy at ASTP ONC, he let us all know that Sequoia had released some new SOPs for the TEFCA, which he improperly said it was. It is actually, as you guys know, we have rebranded TEFCA to the Freedom Health Data Network. More to come on that. Can't blame him here because it hasn't been officially released, but excited that the Freedom Health Data Network has some new SOPs. Lisa, do you have any comments? Did you actually read these SOPs?
It was like yesterday. What am I, Brendan Keeler? No.
I don't know. Yeah. We should just like have him on permanently. But anyway, this sounds pretty exciting. Yay. Maybe our surprise guest will know some stuff about this. Maybe not. But you can search for this guy, be his friend on LinkedIn, and find all this information probably. Okay, Lisa. What do we have to expect on the
accident?
Shit.
Clicking. Why does it allow me to click it? That's a bad idea.
I don't know. Well, you can click whatever you want. Like we'll just click all the things. So this was shared by Nadine Peever on Health Tech Nerds, but also We Love Becker's Hospital Review. That's where this is from. We forgot to include the logo here, but what do we think with our new VP pick candidate? What's going to happen?
Yeah, so first and foremost, as someone who is related to a German and has lived in Germany before, Tim Walz is clearly of German descent, and yet he pronounces his last name Walz versus Wolf, which is how you would say it in German. So just a little German language note here. I
guess he's like a real Walz. American. He's changing his name, like because he believes in his country.
Exactly.
Yeah.
So with that said, Tim Walz has done some really progressive things around healthcare in the state of Minnesota, which is kind of cool because states can do stuff. That's kind of how states work if they want to. And so, anything that's like a state policy, just, remember that like once these policies get to the beautiful exposure of Washington, D.C., like things change and things are not as possible or as feasible. So like everyone calm down. Tim Walz is not going to give the whole country tampons, but he probably should, just to be clear, just as one example.
Yeah,
but like things that work in a state, like don't always work in the whole country and at the federal level. So like everyone can calm down. But like, yeah, he's a progressive governor who's done some cool stuff.
I don't know if it's actually like super interesting from a federal perspective, like if he becomes real vice president, but his administration is the one responsible for, initially there was a no-go rule on being a Medicaid plan that was for-profit in Minnesota. I think it was like 2017 or 2018, that actually changed. And so for-profit plans like United Healthcare, which is headquartered in Minneapolis, was able to,
weird. How did that happen? What a strange coincidence! I have no idea how this could happen.
IDK, but now it's been this administration has switched it back. So now United cannot be a Medicaid plan. I guess they're like trying to like lobby against that or whatever the hell they do. But yeah, 2025 that
that's actually
they can no longer be for profit.
That's a really great like federal healthcare policy note, like. United Healthcare, i.e., the biggest healthcare company in the universe, is headquartered in Minnesota. Like that's actually a legit. That's actually very interesting. That could be. I forgot about that. Of course, they're in Minneapolis.
Yeah.
So, we'll see.
Along with our friends at 3M, there are actually many large healthcare companies based in Minneapolis. So I don't know. But anyway, like I said, at some point we'll have more analysis that's actually meaningful related to the elections. Probably not today. So this is exciting too. Roche bought Flatiron, and now they're going to not own them. And part of the reason they don't want to own them is because a lot of their pharmaceutical friends did not want to work with Flatiron because Roche owned them. So weird. I don't know how that works, but this is big money.
Acquisitions are just a whole, here's the thing, right? It's really easy to sit here from the sidelines and go like, you could have done some due diligence. But at the same time, like, that's all we can say from the sidelines is like, you should have done some due diligence and thought about like what this means. Late breaking, like, did not make it into this wonderful presentation, but as we have talked about, I think before, 23andMe has been in the process of imploding for some time now, losing all of their value as a company in general. And apparently they just came out with today that they are, and you're going to love this one. They bought a telemedicine company, Lemonade, and it was like this weird, like, why did they spend money on that? And then they just announced they're getting rid of their entire drug discovery team and doing GLP-1s through their telemedicine company.
No. Are you serious? Oh shit, I just got excited. I dropped something on my keyboard. We like, wait. Yes. Are you serious? 23andMe is going to...
Yes.
Yes. Are you fucking kidding me?
I wish I were kidding you. I just read it like a few minutes ago. So bad.
Wasn't the drug discovery thing like the path to the future and all the... What the... You're lying. That's not true.
I swear I am not lying. Honestly,
bullshit.
Like, I was like, that is actually what you should fire a CEO for. Like, no offense. I mean, she seems like a nice lady, very smart, done some big stuff in her life, but like, that is, what a weird time to jump on the GLP-1 telemedicine chain. Like when it's like just about to like implode and there's like lawsuits pending and like, you know, whatever. Good shit. Times. Yeah.
That sounds...
So drug discovery, complicated space. 23andMe is definitely not doing it anymore. And in this case, you probably could have predicted that if your whole business was like getting data from other drug makers in this like discovery space, that they might have a problem with giving it to their competitor. Just a thought.
Weird. Yeah, you never know what went on the inside, except a lot of times, Lisa, we do know what goes on the inside, and it's mostly dumb. Like, again, if the world was rational, I would not have a business. So I'm grateful for that.
Yeah, for sure. Real talk.
Oh, I included this this little image just now. It was in the Stat Afternoon newsletter. This is just like my personal PSA to all women in America. Like, just in case shit goes down, you should go to your OBGYN and get yourself a long-lasting IUD just in case. Because again, the long cold winter applies to more than the markets. Just saying, you might want to take that approach. I don't know.
Yeah. People
could be bad.
To take care of themselves. And women's healthcare decisions should be their own. That's my...
I live in the South, so I am prepared. Y'all. You never know what's going to happen down here. So just saying. That's just my personal opinion about what maybe you all should do if you're at all worried about your bodily autonomy. All right, moving on. Oh, Lisa, you'll like this one. This is something else about Medicare Advantage that, you know, like, apparently we just hate. We hate Medicare Advantage. It's the worst. Everyone knows that. Everyone's told us that we hate it. So,
I mean, you know, I know you're being facetious here, but like, really,
it's kind of right now. I
mean, right now, like all of the like, they taste that everyone smells blood in the water. Sorry to be like maybe a little too obvious here, and they're like, "Ooh, let's find more." You can find these things in like every Medicare code that is related to this, right? Like this isn't exclusive to Medicare Advantage. There's plenty of nonsense happening around other types of codes like this, or other ways to incentivize different types of providers in MA or in any risk-bearing entity or in all kinds of other programs. So like, yeah, you know, when we talk about fraud, waste, and abuse, let's also think about this, right? Like, what are the unintended or maybe even intended consequences of some of these programs? Like, you do have to have monitoring and like the ability to cut it off when there's 15 billion that's just like floating out the door, for example.
Yeah, for example. But yeah, this is all about these nurse home visits when you're a Medicaid or Medicare Advantage beneficiary. If you look like you're at risk for blah 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 something or other, a nurse comes to your home. They do a visit. They try to identify the diagnosis that will get them additional money for you being one of their beneficiaries. And so this is actually a pretty interesting article, I thought, and there's all these wonderful charts where they were saying a lot of what these nurses had to do is they would look for potential to diagnose as peripheral artery disease. It's a little thing that goes on your toe. One of the nurses cited in the article was saying like she tried it on herself and like got all kinds of different results, like it didn't really work. I forget who she was, Home Visits, or I forget what her company was, but they were like, nah, it's good. But as you can see here, United Healthcare brought home $1.4 billion from this from this practice. And then you'll see on the right all the additional monies that came from the other insurers. So it definitely was like a big thing. There's the article is pretty interesting too, because it's saying like people were diagnosed with depression or identified a potential diagnosis of depression that also got additional money, and they never really even knew that that happened. So all kinds of interesting things. Insurance is weird. The United States health system is super weird. So just, just like more interesting things to think about. But another big company in this space that we've all heard of is Signify. And they are featured prominently in this article as well. So check it out. It's pretty interesting. Mostly just gives you less hope for US healthcare, but always good to know things. Lisa, this is your article.
Yeah, I mean, so Kat and I are of different minds here. If you've been watching our show for a while, you know that we have slightly different perspectives here on Ozempic and GLP-1s. And Kat has multiple times sort of pointed out, like, this is the playbook of opioids, it's happening again. And like in this case, I think this article agrees with her to some extent from Business Week, and it just really talks about like where are people getting like massive amounts of these prescriptions. It is not in necessarily big cities. It's in places that have also been hit really hard by the opioid epidemic and maybe don't have the most amazing primary care like system and various different types of doctors, lots of urgent care, et cetera. And they found out that Bowling Green, Kentucky has one of the highest concentrations of people with a prescription for a weight loss drug, and they're getting it through they're getting the compounded versions. They're also getting the branded versions. It's all over the place. Really interesting article that talks about the reality on the ground for patients and what they're seeing and how they're hearing about the drug and how they're getting referrals and like what that actually looks like. So I have to say this one kind of supports Kat's perspective of following the playbook. So let's keep an eye on this one.
They're coming for you, America. Yeah, no, it really was interesting. They were saying, I think that average cities, it's about 1% of the population has a prescription for a GLP-1, and Bowling Green, it's 4% of the population, despite it being quite tiny. So interesting stuff. Yeah. More to look at. This I just included because I like Health Catalyst NASDAQ, little HCAT. Like, I just really like that, but God bless them. I'm glad they bought someone. That's great. More news about like primary care just doesn't work when bought by larger companies. Apparently, I don't know.
This is the retail. This is the culmination of this, couple years of interest and excitement around retail healthcare with Walgreens, CVS, Walmart, everybody else, and yikes. There's also some weird stuff happening here with VillageMD. Like there's like some weird contractual things where like, they got a bunch of money, like millions of dollars. So like something's going on.
There's like, this is again, one of those, like, who knows what happened in the back alley deal, but some people know. And it's not us.
See my previous comment about due diligence and how easy it is for us to sit here and go like, like, did you do your due diligence? Did you report a grievance?
Yeah.
Wow.
They may have, but there was probably one guy or one girl who was like, let's do it. Let's go. All right. Yes. This is just a note that like, hey, like the telehealth extension is set to expire at the end of this year. And it looks like despite the fact that it is overwhelmingly supported by both sides of the aisle, it is likely going to be a last minute sprint. So a lot of health systems are preparing for it just not happening, just in case, because this is the great federal government. Or these are our legislators, which is even worse. So anyway, keep an eye on that, y'all. This is just Brendan Keeler wrote a super fun article about all the things that have happened since April. It kicked off with the epic particle drama llama and like kind of put like our silly national networks on the map. Like what? Like people actually kind of care, or maybe just a dozen or so people more care. I don't know, but it's his good stuff. So check him out. I think his company's also doing a webinar and some stuff. I think we forgot to post that last week, but we'll figure it out. And then Lisa and I are going to UGM Epic user group meeting, and we are going to do a live talk show while we're there. We'll see how much I feel like the decision to bring Kat and Lisa to Epic's UGM is kind of like the Today Show or whoever, NBC, bringing Snoop Dogg to the Olympics. Like, yes, could be bad.
Exactly,
could be
like
bad.
That.
Could be really good. We're not sure. But yeah, we'll see what happens. Like, I feel like we're going to put on a good show. I don't know.
Well, I think Snoop Dogg at the Olympics was very good. I think we have a lot to live up to if we're going to be that great. So TBD.
Yeah, yeah, it's going to be really hard. But I feel like in health tech, like I feel like it's like a similar, I don't know. Okay, and then the last
Expectations are
thing,
low.
very exciting. Our special guest is, he'll be on the end of the show, Mr. Paul Wilder, who is probably our favorite Q-hit at Commonwealth. We don't know. But today is his birthday, so he is on the show at the end, and he is going to tell us probably something amazing. I don't know, but this again, fine last-minute graphic work by Maxine Kowalczyk. God bless her. God bless her all the
I
time.
think that looks like a real image too. I feel like all those
I think it's
individuals and
real.
animals were there. Yeah, it's perfect.
Yeah, it most likely is. It most likely is. Okay. All right. So we're going to talk to our first guest, Lisa, who is it Christopher Wink or Chris Wink? We don't know, but here he is.
Chris.
No way to know. There's
we don't
literally no
know.
way to know.
But it does say Chris in his thing. Oh, Chris. So Chris, Lisa picked you up on the internet.
Yeah,
It's true.
I do.
Oh my
We
God.
thought we shut down. You thought you shut down Backpage, but it's still actually live, and so here I am.
Oh my God. Okay, but Lisa found you. So
Strong start.
first of all, I want all of our viewers to know we do have several Philadelphians in our viewership, and Chris sent us an email.
Are you saying I'm going to get booed? Is that what you're saying? I'm going to get booed?
No,
Is that what you're
they'll love it.
implying?
I'm actually I'm from Eastern Pennsylvania, not necessarily Philly, but in his email he called us U's. He was like, "U's are doing great" or something. And I was like, this is great.
Strong.
This is like real regional flavor. So, but I think Lisa, you found Chris because he wrote about what was one of our favorite companies, Benefits Data Trust.
Yes. Well, he didn't just write about it. He wrote about it, and he also does these, video explainers, the ones where you have like a chart in the background, which are really solid. I love them. So
Yeah.
it's a
People
great
said I need
breakdown,
more
kind of sticking it.
me
Yeah.
data and charts. That I get that request
Yes.
a lot. So
Yes.
that's
Totally.
comes up a bunch.
Tell
Yeah,
us
that's true.
that story.
Yeah, I work at Technically, and we're a news organization. We cover tech economies, and Benefits Data Trust was headquartered in Philadelphia, and so we covered extensively its rise and its demise, which you guys take an interest in. It sounds.
Totally. Yeah. So, okay. Well, tell us a little bit more about yourself. Cause like, again, you got picked up off the internet, you write this thing. I think your profile says you're an entrepreneur also. Like, just tell us a little bit about yourself, and then we want to get the dirty dirt.
Yeah, I do have an LLM and a multi-level marketing. So I'm doing LLM, and an MLM.
Shit.
So this is an opportunity.
Wait. So I spent a lot of time in Utah. So tell me about your MLM.
Yeah, it's a whole vibe. It's a cruise ship in Utah, actually. So it's a real
on the Great Salt Lake. Is a Great Salt Lake.
On the Great
cruise.
Salt Lake. Oh my God. Oh my God.
So yeah, I run Technically. We're at team 20. We're celebrating 15 years of publishing this very year. So local news can thrive. We cover tech economies in a handful of U.S. cities, and that often means kind of workforce and entrepreneurship. But we cover when and how technology is deployed for all sorts of reasons. So Benefits Data Trust is a social services organization that use data and digital marketing strengths to try to close the benefits access gap. That was an organization we've covered for many years and followed its collapse just this summer.
Yeah, the decline and fall.
So yeah.
Well,
so
Lisa,
it's a journalist man, but run Technically.
Lisa, why did you love this? Why did you because you were like, I love this. Like you were like on it. And you were like, I'm going to invite him on the show. OMG. Yeah. Like, tell us more.
Who hurt you, Lisa, is what she's asking.
I know. Well, she can't hurt me, actually. Just to be
clear, it's probably me.
It's fine. No, I mean, I was obviously really interested in this story for a lot of reasons. I run a nonprofit organization. We're not a service organization, but we're in a similar space from a policy perspective as Benefits Data Trust was/is. And, first and foremost, like when you see that, you're like, oh no, what happened? And like, what can I do to not repeat that? Like, how do I, as a leader of a nonprofit organization, how do I help there? But also, bigger oh no was that Benefits Data Trust has been around for quite some time doing a really, really important service. When I first learned about them now years ago, and understood how they were trying to use, consumer grade, essentially, tools and processes to get people signed up for the benefits that they are already eligible for, and understanding how hard it is for people to get connected to benefits, and what that can mean for the outcomes in a particular city or state or an area of people having resources, having food, having housing, having other services. I was like, wow, what a loss, what a miss. And, I think one of the things that really spoke to me in the story was the initial information that was floating around about the investments in AI tools, which if you have ever watched the show before, you know that Kat and I are extraordinarily skeptical of the AI bubble that we're in right now, especially when it comes to critically important social services. So that's what really spoke to me with the story. And you really covered it in some good detail with some good background information about the organization and also what happened in this case. So maybe you could just bring our audience up to speed on what you learned and where it is today. Because they're in the process of closing down for sure right now. Yeah.
Yep. Yeah. By the end of the month, they'll essentially close. They serve nearly a dozen mix of states and regions under government contracts. So there's a couple points that I think are widely interesting, whether or not you care about benefits access specifically. But the quick snapshot is it's 20-plus-year-old organization founded by a former credit card executive, Walter Cantor. The story of Benefits Data Trust was, as you said, trying to take modern technology, software, and digital marketing savvy and saying, we're going to just close the benefits access gap, right? Like this is not newly necessary government funding. These are already appropriated programs. We just want to get people to apply for the Pell Grants, access food stamps, get on that LIHEAP existing programs. We just want to close the gap of people who aren't using programs already there. And whenever there's a story, as we were hearing of a pending closure, you always first say, is there any financial mismanagement there? And so really quickly, the first kind of range of off-record conversations were just, hey, gut check of people inside the machine. Was there concern of that? And of course, you'll see how it plays out. I've been surprised before, but that does not seem to be the story. There does not seem to be anything, any criminality involved.
The CEO going on a private jet, like that's not the issue.
Correct. Of all the criticisms of leadership, including both board and former CEO Trooper Sanders, who I've interviewed before, anything illegality is nowhere near in any of these concerns. I've been surprised, but that does not seem to be the narrative whatsoever. Instead, the two narratives that has instead come out is either one portion of this was just flat out a belief that we'll always play for the next giant grant. Basically, roughly, you could say 2/3 of their funding came from philanthropic sources, and a third came from government contracts. So, a state would say, "Hey, Benefits Data Trust, we've put out an RFP. You help more residents in Michigan apply for and get on our stamps programs," and they would get a contract, and often those contracts required Benefits Data Trust or whoever applied for the RFP to also match it with some philanthropic or other funding source. And one of the novelty that Benefits Data Trust teammates are proud of is that they were a kind of R&D lab because they did a pretty good job for many years of bringing philanthropic funding and say, hey, we're going to experiment with this digital marketing trend to try to convert low-income residents of the state to get onto, let's use, LIHEAP or food stamps as an example. And these were seen as success stories. They were always trying to learn what is the conversion. So one criticism is they just kept making bigger bets on, we hope if we invest in this next program, we'll get the next grant, and that it ran out. And so some staffers just think it's plainly on the fault of the board and leadership of getting ahead of its skis. I brought a visual aid that I'll share with you in a moment because I'm on the drive time talk radio of health tech. So I want to bring my A game.
Yes.
So absolutely. I have a visual aid on that I'll share. So that is one narrative. But leadership's narrative is there was incredible pressure on bringing down the per application cost of BDT, that there are many kind of pure software services out now, an online form you can fill out. And as one person pointed out to me, there are those that feel even if that online form only gets 30 or 40% as many people as an in-person call center, which is what one of the actual investments Benefits Data Trust had, that there are those who feel that was such a lower cost, even if that online form that only gets 30 or 40% people, but it's a nickel to every Benefits Data Trust dollar, that there's a belief that it doesn't matter if that call center who will stay on the phone with a grandmother trying to get for energy assistance, that's too expensive. And so the leadership says, we were just going as fast as we could to bring our costs down, and we couldn't get there fast enough. And that is fair or not the two narratives of we were racing against time and couldn't get there, or you dummies, you knew this was a problem all along, and you just kept hoping that Mackenzie Scott would show up and write you a big enough check to cover the hole, and they didn't. those are broadly the two narratives that are out there.
Yeah. What about the AI investment stuff? Because it seemed like Trooper Sanders had really worked on his public profile to be like, I am an AI expert entrepreneur. I'm using AI to get people connected to benefits. And like, that isn't, knowing what I know about AI, I'm going to say that probably was a little bit not accurate.
The generous interpretation would be, no one in leadership thought that was going to solve the world. But one, you have to, as many of those who fundraise against some philanthropies, feel like you always have to be presenting the next thing you're experimenting with. So some in leadership said this was purely a mechanism. We were experimenting with AI, but none of us thought this was going to solve everything. But it was, of course, we do see marginal, and we're seeing this in labor data, we're seeing marginal improvements in efficiencies. And just like any other organization, Benefits Data Trust always was trying to do best practices. So just like anyone else, we were just bringing marginal productivity enhancing efforts in via this work. And it was a headline in a lot of our impact reports and philanthropic packages so we could win new grants. That is the more positive story of it. But you're right. There's a criticism of others who say they were obsessed with it and that they did believe the hype and got overextended on it. And there's a bit of war on the worlds of which is a truer narrative. A couple anecdotes in the piece that get at that.
I think the other thing that I read about, there was also a big like open letter from the employees, to the board and to the former CEO and everybody, just saying like, when did you know? Because I think you mentioned that as well, because basically like their budget got approved, everything was cool at the end of the year, beginning of the year, and then they, out of nowhere to the employees and to the public, shut down. I mean, that's a typical sort of governance question, governance concern. When did you know? When was it? Where was the board? Always a question. Nonprofit boards are hilarious because they're volunteer activities, and they're serving in a very specific role until it's like, by the way, the whole organization is on your head. Like, better figure it out. Better have enough oversight. Better figure out what that looks like. So it's a difficult position to be in. Kat and I are both nonprofit board members in various ways. And so, I think it's just like, that was the other question that the employees seemed to have and the public had. When did you know?
So as I've run a local news organization for 15 years, and we both train our reporters, but also I myself, I am a more than usual sympathetic eye for leadership. I've experienced how things can go left. And I think sometimes in the press, we show how little we understand how difficult these situations are. So when we cover startups and others who things go wrong, we tend to understand that good faith actors can get tripped up on stuff. So we tend to take a sympathetic eye. But a couple things I think stand out as different here. One, we, like any, tend to take a higher set of standards for nonprofit. There's a reason we have higher regulatory and governance standards for them. There's essentially a trade. We give you some tax breaks, and we expect you to operate in a different way. And it's deeper still when you're operating at the size and kind of work that Benefits Data Trust was at. When you're working in deep social services, as someone put it to me, I think in the kicker of my piece, the mix of innovation works when you're in a startup and you're mostly putting some staffers' livelihoods on the line, which is a real risk. That's different than when you're working with people in deep poverty and you're stitching together their livelihood or not. Those stakes are higher. So I want to just call that out, that I think it's okay to level up the stakes, even if I tend to take a genuinely sympathetic eye to a lot of people who can make some mistakes. And I think the more literal answer to your question of when do they know, there's two ways to answer that. One, the word that I got is that the most recent rather than the interim CEO, the most recent proper CEO, Trooper Sanders, was himself surprised that the board decided to close the organization. So even at the leadership level, there was some disagreement about whether this was not something they could have still gotten out of. And they're also, having looked at enough audits and P&Ls in my day, there are people who can look at the same numbers and have a different decision. Can we climb out of this or not? How much? So someone put it to me that it felt like a board that was super interested in innovation for a long time turned real conservative real fast when it suddenly felt very real. That suddenly we're like, whoop, we're going to make sure we pay everything and close out as quickly as we can.
Interesting.
So what do we think in general? So I actually thought it was like kind of like weird in general that BDT was a nonprofit at all, right? Like there are private sector company, like there are for-profit companies that operate in this space. And I was like, oh, this is kind of weird and fun. But as we all know, you can still make a shit ton of money being a nonprofit. Like that's when we see salaries over $500,000 a year because there's no equity, right? Like they just like give you cash. But yeah, like what do you think in general about them operating as a nonprofit?
I think that the era in which they formed came at a time where there's probably some sensitivity to it. I think there was some sensitivity around the founding story. I've heard that folks didn't want it to be perceived as a cash grab. So the nonprofit kind of signaled something to the market that we see this as a public good in which we're trying to figure something. So there's some signaling to it. And as an aside, because I think you're right, Kat, I've seen that a ton too. In the financial disclosures, there really didn't seem to be much excessive pay at all. So I want to underline that very much the narrative is this was not about greed in a financial sense. It seems this was not about criminality. When you speak to enough staffers at all levels, there was a very real sense that they were doing real incredible work. So I don't think you were foolish to consider them an organization that you guys admired. I think it's a kind of interesting wrinkle to the story. I don't think there was a lot of that kind of mismanagement. So I have like a pet theory that we also have had an interesting thing happen in this pandemic era of a whole class of nonprofits that were adjacent to the cheap money era. We've done a lot of reporting on a whole different kind of nonprofits that had a giant zigzag of income. And I've been pushed that that's not a full BDT story. There were critics that leadership had as early as 2019 been making bigger and bigger bets. So I've been pushed back. But I think there's also a macro point for your, wonky audience to note that I think something bigger is also happening. I think in a lot of nonprofit impact orgs that have got very mixed signals from 2020 to 2023, even that sent them all over the place. And I think there's a glimmer of that in the BDT story as well.
Interesting. This is why we need reporting, local reporting. It's amazing because you have a perspective that nobody's really covering the story besides you and us and the Philadelphia Inquirer to some small extent, but like nobody's got the detail you have because
and the internet
who would care except for like nerds who care about the Philadelphia and like the Pennsylvania generally sort of tech market. Like that's so super supportive of your work. Show us your visual aid. Let's do it.
Yes. So here's my pet theory. I'll send your team, your audience out with. So we're filing something. So I'm giving a preview of some back data on something we're publishing Monday. That is part of my pet theory. So this is a health tech talk show exclusive.
We got to add it to the stage. Here we go.
Yeah. Do we get it up? So here's something that's interesting to me. So these are. Did about so the 990s from about 30 tech adjacent nonprofits. So these are groups that are either doing workforce stuff, civic technology like Code for America. They're either doing workforce training, entrepreneurship support, or kind of deploying tech in a social services organization. And so looking at the calendar year, the pandemic years, 2020 to 2023, like more than half of the groups that I looked at had some pretty outrageous pop in revenue, kind of single years of giant raises. And there's a lot of different stories in here, but there's a commonality. So the orange bars are all nonprofits that have closed in the last 90 days.
Wow.
And they all had essentially the largest single increase in income during the pandemic era. So they're all either 2021 or 2022. We have that data, but basically a whole class of nonprofits, including Benefits Data Trust, had single year giant pop. And so a couple of these organizations do actually have Mackenzie Scott dollars in there. Now, I actually am a fan of the way Mackenzie Scott has handled things. So actually, I do not want to misinterpret this narrative because Code for America got a relatively large Mackenzie Scott. They also got a very large multi-year commitment. So Code for America is a different kind of story. But the Benefits Data Trust pop includes a big increment. But Women Who Code, Benefits Data Trust, Venture for America, just this week, technically was the first to report that this dozen city organization is closing, and Bite Back, which operates digital literacy training around the DC, Maryland origin. They all these giant pops. And so when you talk to folks inside, they're just, and frankly, my own personal experience, I'm sensitive to giant revenue growths in mission orgs can be very disorienting to know, is this a level up or does something transform? So code.org had a giant pop, but actually has maintained the income app. So they got to a new level up. A lot of these other organizations that collapsed, single pop, staffed up or added programming for it, and then the revenue went right back down to where they were, and they got over their skis and had their things fall out. So that's my visual aid that I wanted to contribute to the Health Tech Talk
Amazing.
show.
Oh my God. I love this. Oh my gosh.
So cool.
Well,
So support
we're
local
probably going to
journalism.
have you
That's
back. Watch out.
Support local journalism. Lisa said it.
I'm doing, that's your shout out. Support local journalism. Awesome, Chris. We'll post that and share whenever you're ready. And super cool. Thanks for joining us. Thanks for letting me convince you to come on the best drive time talk show in health tech.
Yeah, this is the best. All right. Well, we send us that too, because we'll post it on the LinkedIn tomorrow with our recap.
Please.
But thank you, Chris. You're awesome.
Chris.
All right.
Yeah.
Let's get rid of this guy. All right. Now we have Dr. Sipra Laddha from LunaJoy. So who was pitched to us by a local Philadelphian. What the hell? This is the Philly show. So welcome to the show. So tell us about LunaJoy. We know you just got a new round of money, and you're in the women's mental health space doing stuff. So tell us some things.
Yeah, so LunaJoy started about 3 years ago with my co-founder, who's also a psychiatrist. I'm repro psych, and she's child and adolescent psych. And so we do two things. We do women's mental health with a special focus around pregnancy and postpartum. And so services, right? Medication management, therapy, coaching, mostly covered with insurance, both commercial as well as certain Medicaid plans. And then the other side of what we do is behavioral health integration. So working very closely with OBGYNs within their EMR, within their technology, as well as back end of payer technology to make sure that we are capturing screens in real time, we are assessing who might be at high risk for developing PMADs, and that we are most importantly getting them into care as quickly, cleanly, and seamlessly as possible.
Okay, I didn't know if Lisa looked like she was going to ask you something. Okay, so I have a bunch of questions for you. So first, you are in women's health. You have successfully raised a bunch of money. That is great. What do you think of the funding news from last week with our friends at Flow?
Amazing. I mean, it's very exciting, right? It's exciting to see women's health get more money to really achieve this like global status and fame. I do think it is one of those things that hopefully will signal more investors to start paying attention seriously to women's health. I know that when we went out to raise at the end of YC, we probably pitched 110 investors in about 3 weeks. And there was a lot of interest in women's health, like, oh, this is cool. Like, let me listen to your 30-minute pitch. But, I have no real pattern recognition in women's mental health or in women's health. And so educate me, but, I'm going to sit back and wait and see until I really understand more about where the women's health market is going. And so very excited for the fundraise, very excited to see that kind of success. And I hope that it is good market signaling for investors who've maybe been sitting on the sidelines wondering if this is a real thing or not.
Yeah, so there was a lot of criticism, of course, about it being a bunch of white dudes that funded a bunch of white dudes. But you're saying, like, who cares? Like, it's getting people interested in the space. And like, I think that's like real.
Yeah. And, I think in some ways beggars can't be choosers, and women's health, like women's rights, women's health, all of women's like progression, whoever is willing to back that, more power to them.
Yeah, well, right on. That is a very positive outlook, and I appreciate that. And then the other thing I wanted to get your perspective on is, so you do prescribe medications.
We do.
And we've seen a lot of drama llamas with Done and Cerebral and just, people prescribing these drugs to kids and like no parental supervision and like all kinds of bad things. So how do you exist in a world like that where there's so much of the drama?
Yeah. Well, I think this is like really highlights the need for strong clinical governance, right? There's a lot of drama. And I think anytime that you're mixing people's healthcare and their lives and medication management with profits, right? It is really important that someone very strong is at that clinical helm, making sure that great, we're here to make money, but are we doing things that are responsible? Are we doing things that are in the best interest of our patients? And so I think that's what it really highlights. And I think for us at LunaJoy, we didn't feel like it would be fair to really be able to go out there and give a solution that didn't involve medication management, because I think there's actually been so much stigma in women's mental health, certainly so much stigma in perinatal mental health, where people are taken off of their medication, don't do anything that's going to hurt your baby. And, I know other startups that won't prescribe during pregnancy, even though there's lots of evidence based around what is effective during pregnancy, what's safe during pregnancy. And for us, it was just really important. And I think for me, my background is I'm a reproductive psychiatrist, that we really offer a full stack women's mental health solution with very clear diagnosing guidelines, prescribing guidelines, and that we do a lot of internal work training all of our providers to be evidence-based in the way that they deliver care.
Yeah, I mean, that's actually one of the areas where you could get into trouble with your investors if your investors aren't mission aligned, I'm sure, because investors are trying to get a return on their investment. They may have, a background, they may have, things that they care about themselves, but that's a place where you can see that I think other startups, maybe not exactly in your space, but in similar spaces, have really been pushed to go too far. So, I mean, clinical guidance and clinical oversight, that's a cost center. And it's something that slows the fire hose of profits, which obviously can get you thrown into jail and can get your startup to collapse. So it's this constant sort of game. Have you had this discussion with with VCs, with funders in general? What do they tell you? Are they like, please grow quickly? Or are they like, please don't go to jail? What's the level of
Yeah, I think that this has been really interesting, actually. And I think that it was a huge part of our selection process. I feel very fortunate that Shema and I were in the position to really decide which investors we wanted to work with and which ones we didn't want to work with. Nice. And I think it becomes very clear when you're talking to an investor, usually within the first 15 or 20 minutes, or even if you look at their portfolio companies, who's interested in creating a stable product that is going to grow and be impactful and make money and last for not a year, 5 years, 10 years, but 50 years, 100 years scale, that sort of thing. And who is looking for the quick in, I need, a quick headline. I need to show my LPs some really sexy news. And it's also pretty clear, I think, who has respect for the idea that this is health tech. It's not tech.
That's a great point.
And so
we're not doing a random consumer product here, guys. Come on.
We're not Uber, right? We have people's lives that we are dealing with. And I will say I love all of the investors that we have on board, and every single investor that we have has completely understood that it takes time to scale and grow a company, and that there's certainly, all the places that we're stepping on the gas, I think, are great. And we are not going to do anything that is going to jeopardize our patients, their care, our reputation.
Nice.
Awesome. So I saw that you guys, so we talk about this a lot when we talk about women's health, Lisa and I do, that a lot of women's health is focused on babies, having babies, reproductive, but y'all are also doing menopause care, which last time I checked, pretty much half of the world's population won't have happened to them. So what was that something that you always had embedded into your product, or is it a new addition? Tell us about that.
Yeah, so really we treat women across the lifespan, right? When we think about these hormonal shifts, this is the time that we see a lot of mental health issues come up, whether it's puberty and adolescence, ton of mental health issues come up there, pregnancy, postpartum, ton of mental health issues, and perimenopause as well. Perimenopause, I would say, is the one area where we don't even have regular screening. It's a very missed population. We're not asking, they're not telling, but they're actually one of the highest risk populations for suicide. And it's a lot of different things are going on. There's social changes, there's hormonal changes, there's taking care of elderly parents, taking care of kids that are maybe emerging and going into the world and being in interesting places sometimes with your career all at the same time. And so I think that is very much a population that has been overlooked, kind of underserved. And for us at LunaJoy is one of those things where it's every single one of these transitions is very important. We see kind of a distinctive group of things that happen. And, women who need mental health care at 16 are likely going to need it when they get pregnant, are likely going to need it when they get perimenopause as well. And so really creating this long-term relationship with patients over time and being the trusted mental health provider for all of those phases was very important to us, instead of being just 1-2 year period in your life.
Yeah.
No, I was just
Lisa.
going to say we forgot to put in our news show today that the CDC finally came out with new guidelines for pain relief during IUD insertion,
Yes.
which I'm sure is relevant to your various patients and users of your platform. You want to talk about that? And like, you guys probably hear about that all the time. I mean, it's been an issue.
Yeah, it's the bigger concept, which is that pain is so normalized for women, right? There is so much actually unnecessary pain that's normalized, whether it's IUD insertion, whether it's like suffering when you're pregnant or postpartum, whether it's suffering when you're perimenopausal, whether it's bad period cramps, whether it's endometriosis, where women are told that, you know, they're crazy, it's all in their head, the pain isn't real, they need to just go home and deal with it. I was super excited when I saw that headline because, you know, I think that the tide is starting to shift where the woman's experience matters. There are things that we can do. There are very simple clinical protocols that we can put into place to make sure that we are addressing pain, that we are addressing mental health. This is truly not rocket science. And it's, you know, in one sense, it's maddening that it's taken so long for general health to start to recognize that a woman's experience is important. On the other hand, it's very exciting as a reproductive psychiatrist that finally now in 2024, we're saying, yeah, you got to treat the woman's pain when you give her an IUD and yank open her cervix and shove something in there that is important to make sure she's comfortable.
Yeah, I mean, you just, it was one of those things where the self-reports were just deafening, truly. I mean, there have been so many self-reports and of course real research of people's experiences that's been published in peer-reviewed journals, but like the self-reports were getting out of control, like people sharing on Reddit, on social media, on just like constantly on TikTok. I don't have TikTok. People tell me it was on TikTok. People filming themselves like secretly while they were getting these procedures and showing just like the experience and how they were being treated by their providers, who were telling them to suck it up, to stop crying, to like just the most just truly shocking just miscarriage of justice and like treatment.
Take some Tylenol.
Take some Tylenol, baby. And it's like, holy crap.
Yeah, that's why I think talking about it is so important, right? Because otherwise the message is grin and bear and go home and move on. And so when you hear other people talking about it and it's replicating your own experience and you're empowered to talk about it, I think this is really how we start to see change, because there are more modes of communication. There is social media. We can come out with a larger voice and be like, this is not, you know, a one-person problem where you're just weak and you need to take some Tylenol and sleep it off and be done with it. This is actually, you know, a consistent thing that we're seeing in the field, and it's a problem and we need to address it.
Yeah, like I had to get a whole tooth dental thing, whatever. Probably lots of people have had dental surgery of various types. There's like amazing painkillers for dental surgery. Like they're like first of all, localized lidocaine, which is one of the things that was recommended in the CDC's recommendations, is, you know, not the only thing that's available, but it's like pretty great. I mean, you know, the fact that we have these really very effective, short-term, localized anesthetics of various types is like really cool. Like we are living in a truly amazing time to be receiving medical care, not from the money perspective or the access perspective, from the actual experience in many cases. You know, we have so much available to us. So it was really just wild that it hasn't been applied before. There hasn't been a strong recommendation before. So I'm excited to see what this brings. Hopefully more, because the recommendations didn't quite go far enough, I think, is kind of the initial, you know, feedback from the market, from the people, from the people,
from the United States of America. Well, Sipra, so listen, I love entrepreneurs. I think Lisa and I both start a lot of things. We have many companies, and it's really hard to be an entrepreneur. So how did I know you're a YC company, but how did y'all even get into this?
Oh gosh, so I would say that we are the unlikely entrepreneurs that stumbled into entrepreneurship. I did residency at Emory in Atlanta, Georgia. I graduated a year early from college. I was so excited to get to medical school. All I wanted to do is go out there and practice medicine. Did undergrad in 3 years, went to med school, went to residency, and then right after residency started my own private practice. So I think entrepreneurship just kind of runs in my blood, and I immediately knew that I wanted to be dealing with a pregnant postpartum population. Also worked in the VA system where I was looking at lots of systems and processes and, how do we get patients care and things like that. I did that for almost a decade. And I also had 4 kids during that time. So my last year of residency, I had a set of twins. Yeah, I had a set of twins. biggest, most pivotal, event in my life, where I had a very academic understanding, I think, of reproductive psychiatry before that. And then going through the process, having this, high-risk twin pregnancy. I had my own journey with postpartum anxiety. And here I was like, I'm fully trained in repro psych, and I'm actively seeing women in clinic who are dealing with this. And I have no idea where I would get resources for myself. I have no idea, where to even really start. Like, it is really bleak out there. Their wait lists are 4 to 6 months long. This is just not a great setup the way we do things. So that was, an early learning, and got myself the help that I needed, started my private practice, scaled that, realized we can't, I wanted to have impact greater than just these are the 12 hours that I have in the day. And this is, the people that I can see in those 12 hours. And so my co-founder and I, it was middle of the pandemic, it was 2021, we started building EMR integrations and workflows just around getting EPDSs and OBGYN offices over to us. Like, you have this screen, it just sits on the EMR. Like, 85% of those women that are screening positive get no care at all. How do we just use technology to do this little unlock? We went up to YC a couple of months later. We filled out the application in my, my co-founder was over for Thanksgiving, and we have 6 kids between the two of us, and they were all running around outside, and we were in the closet, like literally sitting behind the clothes, because it was the only quiet place to put together our YC video application. We just thought it would be really cool to apply. Didn't, really think that we were going to go do this whole thing. And then we got in, and for a week, every day we were texting each other, like, my private practice was booming. My hospital job was going really well. I had these 4 kids. So it was in the middle of the pandemic. I'm like, I don't know that this is a good time to do this. And my co-founder was like, yeah, this is not a good time to do this. This actually makes no sense at all. And then we both called each other on a Friday, and we were like, we have to do this. Like, this is just a problem that has been staring us in the face for literally a decade. We've experienced it. And there's really no better time. And so we did. I wound down, my other jobs. She did as well. We actually moved her husband and her kids into my house, and they did daddy daycare, and we went off to
Cool.
And we were around like a lot of great people at YC, but a lot of tech bros, a lot of people like building, scaling, innovating, thinking outside of the box. And it was just kind of like, that was a really defining experience for us. I think we got the right mentorship and, raised a round of funding. And now we've been working harder than we've ever worked for the last 3 years, just really focused on building and scaling the solution. So that's kind of it. We were focused on the problem. And, I think just the idea of having impact felt so overwhelmingly exciting that we became entrepreneurs.
Amazing.
Nice.
That is an awesome story. And that is a tall glass of water for kids and going through medical training and all that. God bless you. That's awesome. Congratulations.
Thank you.
So we have to give our birthday guest a few minutes here. So what would you like to leave our millions of loyal fans with? What sort of parting words?
Yeah, no, just that I think it's a really exciting time in women's health and women's innovation, and especially around pregnancy and postpartum perimenopause. I think my departing message is it's okay to talk about it. It's okay to get help. It is okay to not do things on your own. As Brené Brown says, we were never meant to. So just really want to encourage everyone out there to take care of themselves and to get help if they need it.
Awesome. Well, thank you so much, and congratulations on all your success. That's
Thank
freaking
you.
cool. All right, happy weekend. All right, now we got Paul Wilder. It's his birthday. How old are you, Paul?
I'm old. Yeah, I just go with that. I'm starting my 50th year around the sun.
Oh my God.
Amazing.
Hold on, let's
Well,
just
it's
make
not
sure
a big
we...
one. It's not a big
we
one.
have
I'm
this.
49, so I'm starting
Your
my
50th year, starting from zero.
Okay,
I got it. I got you.
Okay. All right. So next year, on this date, we will have you for your official 50th birthday. What do you think of this image we created for you?
I mean, when we created that, you took that picture. I mean, I
We
was
took
there.
that picture.
Well,
It's
that's
a
true.
light from reality.
That's true.
Yeah.
It's
Yeah.
real.
Actually, I
Yeah.
do remember the tiger being there. I think everything else is right. Yeah. That's
Well,
right.
you know,
The tiger
Paul,
looks
this is
more
what
Photoshopped
drugs
than the rest
do.
of
You
it.
don't remember
Yeah.
things when you do drugs.
Yeah.
So, don't do
Yeah.
drugs next
It's fine.
time. Yeah, it's
It's
fine.
all good.
Yeah. Anyway, okay. Well, we can remove this photo just so we can focus on you. What amazing birthday news do you have for us? Do you have any dirty dirt? Any
Ooh, do I have any dirty dirt?
Any dirty dirt?
I always have some. I will say from this week, I actually read that the Keeler article, and you reminded me of that whole thing, the summer of interop and all the crazy things going on. And
Yeah, it's like wild, right? Like people actually give a shit about all the interoperability things.
yeah, it's a good distraction from things we don't want to give a shit about anymore, right? So that's good.
Yes.
And there's a bunch of things on the Tefka side. The Epic announcement this week was interesting. The kind of individual access.
I'm sorry, Paul. Do you mean the Freedom Health Data Network?
Yes.
The Freedom Health Data Network. Yes. Yeah. We're going to take that tiger and make it part of the mascot. I think that's
we'll see what's going to happen. We'll see.
With or without the birthday hat, that's up to you. I'm not the image graphics expert here, but I recommend that. That'd be good. Yeah, it's been so Tefka's doing its thing, but the Epic thing was more interesting because they're trying to you guys love regulatory capture, right? It's like your favorite
it is our favorite
conversation, and
yep.
Part of the strategy of regulatory capture is shape the narrative so it hits things that you do well that others necessarily don't. And I think Epic made a very good strategic move here. It's like, hey, we have this way of doing patient access that has a gateway that some don't have, and they make it kind of hard. Let's throw it into Tefka and call it really cool. And the downside is it's likely to have a perverse negative effect on finding all your data quickly, because it's going to allow a bunch of other EHRs to adopt the same method, right? So what they're basically getting at is, we're going to tell you where your data likely is, but then after we tell you that, you have to communicate with each source individually, right? So it's not one login; it's one login plus all the other ends. One login, one login, one login, one login, one login. So when I give you 5, here are the 5 things that might have your stuff, which may not even be complete. They may be missing the other 3 because they don't have a caching RLS, and I don't want to get the technical. You only got like negative emitted here, so I don't want to get into it, but it's going to still make you do all this provisioning. So you're going to be like ID proof once, and then, okay, here's all your sites, and do it again, and do it again, and do it again. And it's kind of not living up to the dream here of I just got, the dream is not getting cancer, but the example is I just got cancer. I need all my data now. I want to go get it through this network. And you're like, okay, that's going to take an hour and a half, and an hour and a half is probably worth your effort. If you got cancer, I get it, but it's still, you'd probably want it faster. So that's a shame.
Yeah, we had a lot of people super confused after that Epic announcement because they were like, the QHINs do individual access, the TEFCA does it, or the Freedom Health Data Network. Not everyone has the branding right, but there was a lot of confusion, and we were like, no, it's just like Epic's thing. And God bless them, that's freaking great that they're doing the thing. But there was a lot of confusion around it for sure. And I would say that, first of all, big fan. I feel like Epic is pretty strategic in general with the TEFCA or the Freedom Health Data Network. They're definitely playing the game on a little bit of a different level here, and I'm totally into watching it. Objectively impressive. But the other thing I'll say is marketing works.
Really? Never heard that. That's interesting.
Marketing works. So what's that meme? What's that? There's some meme going around about, I forget, it's some Spider-Man thing, and it's the guy really likes the girl. He comes in, he's super good looking, he's got a bouquet of flowers, and it's the guy with the great product. And then the other one is the Spider-Man guy holding the girl's hand, and it's just the guy with good marketing. Marketing works, really fancy words work, effective press distribution works. That's what I'll say about that.
Yeah, I think fancy words do work. I think also making something sound simple when it's not, right? And then leaving out all the technical details that make it not work the way you think it's going to work. It's I didn't tell you all that stuff. It's not important. That's cool. It was a pretty good marketing move. You got to give it that.
Yep. Everybody's got to uplift the Freedom Health Data Network. It's the right thing for America. So, Paul, what is your contribution to the Freedom Health Data Network? And then we will depart to start our weekend.
Yeah, honestly, there's one gap that we're able to fill in that announcement that we plan to fill. What Epic doesn't have, and it's just a design thing, is they don't cache for their results, right? They don't remember the answer they gave. So when Lisa shows up and picks her PHR, her consumer app of choice, and gets all of her data, they tell that app the answer. When another one comes, that answer might actually be different because they had a different heuristic. And it doesn't help one PHR to the other. So our plan is to index everything, and any PHR that shows up gets kind of the same exhaustive answer over and over. So if you need that cancer oncology thing, and now you need a diabetes app, and now you need a general PCP app, they all can get the same data, and they're not worried about, you know, who had the best algorithm to go get what or what. And we can fix that algorithm over time to make it more pervasive. So the idea that, you know, we really should consolidate the finding of the data and then let everybody innovate from there. You know, we're still holding on to here at Commonwealth, and will, you know, forever.
My patient app is called Russia USA Health Data. Is there a problem there? Should I be worried?
I don't think so. I think you might be reading it. It's saying Rush Individual Access USA.
Right.
Yeah, that's what it actually is.
Solid.
And so, yeah,
Solid.
Amazing. All right. Well, we have to go start our weekend. Paul, I assume because
Me
it's your
too.
birthday, you are eating a cake
Already there.
with lots, and you're having
Making.
lots of
I'm
alcohol.
going to a cooking class,
my God.
tapas. You know, so it's time to
Aw.
Romantic. Oh my God. Okay. Well, we will depart. We'll just leave this up here. Happy birthday, Paul Wilder. Paul Wilder, as everybody knows, is my mom's favorite talk show guest. So we are happy to have him back whenever he randomly texts us and tells us that he would like to be here. So happy birthday, Paul. And
Thank you.
Happy
have a great
weekend,
weekend.
everybody. Happy birthday, Paul.
All of America.
Cheers, thank you.
Okay.